You don't see him at all. He is away. هو بعيد عنك مش هتشوفه. تمام. We have preparation station and also we have the real station. In both station you don't see anyone. Preparation station you can find a big sheet. I show you the instruction of the candidate. أنا عامل 3 station instruction of the candidate. Okay, not this. All right. اوكي. مين اللي عايز يبتدي بقى فيرست كانديد كده؟ So can start anyone. اوكي دكتور أسامة الجندي or أسامة. دكتور أسامة. دكتور أسامة. عليكم السلام. السلام عليكم. This is the scenario. So what you see in the first room phone call scenario. Phone call scenario ده ساعات بيبقى about 15 paper very big. أنا just make summarized. In this scenario it is written in hand, is handwriting because this is the patient file. أنا هبتدي هقرا معاك أنت الأصول. You have a paper and you write a notes. After that you go to the next station with your notes and you find the same material again. يعني انت في 2 ستيشن، واحده تحضيريه واحده اللجنه العاديه. ف the first station no one speak to you. الستيتمنت كالاتي: you are the you call a consultant in charge Mr. Wolfson. يبقى انت اللي هتكلمه is Mr. Wolfson and tell him about a case done by Mr. Browse. You are another person. انت بقى دكتور اسامه. So you are دكتور اسامه speak to Mr. Wolfson in behalf of Mr. Browse. أنا هبتدي أقرأ كده بالراحة. 75 years old lady with background of chronic obstructive pulmonary disease or airway disease, mild left ventricular failure, underwent mastectomy, axillary clearance for breast cancer 2 days ago by Mr. Browse. Post-operative, she developed axillary discomfort with shortening of breath. 500 cc of blood came out from the suction drain. The patient is due to go to home tomorrow, but due to this complication, she will postpone. Okay, so patient have mastectomy, have comorbidity, have hematoma come from the drain. Her daughter want to take her home, in her home, which is bungalow. Bungalow means a countryside. منزل countryside means in rural area. 60 mile is 100 kilo from the hospital. She was pursued that her mother would be best with her. You have spent last 20 minutes trying unsuccessfully to explain to her daughter the discharge today is not for the patient best interest, so it is not good for the patient, especially since her home is away from the hospital, which is 100 kilo. The daughter is very determined. She wants to her way. She is in school teacher out of the home in the morning, and her husband work also, have 2 teenage daughters in secondary school. So this patient be alone in the morning. This patient file, this is handwriting. This is way of writing. We call it a script brush or brush script. So it's the same, Mr. Annie Mary. So this is name of patient, 75 years old, woman with a background of chronic obstructive airway disease, left ventricular failure, suffered from lump in the upper part quadrant of her left breast, firm in consistency, 4x3, attached to the skin, no bodorange, no tethering, no buckering, mammogram show macrocalcification, irregular mass, fine needle aspirated cytology C5, so it's malignant cell, CT, thorax, abdomen, and pelvis as normal, bone scan is normal, operation detail, the surgeon is Mr. Browse, anesthesia is Dr. Robbins, procedure is left mastectomy and axillary clearance for the breast, insert, I think it is inserted 2 suction drain were inserted, 1 in the axilla and 1 in the breast bed. Post-operative first day, normal, with no sepsis, no pain. Second day, the patient developed axillary discomfort with a shortening of breath. 500 cc of the blood come from the suction drain. A blood sample is taken for hemoglobin level and follow-up. Plan for exploration of axilla and stop bleeding or secure bleeding. Full blood count 2-day post-operative hemoglobin is 9 جرام DL. The others انت هتشوف بقى الحاجات دي وتعلق عليها، يعني هنوريها لك تاني. وبعد كده في الارتيريال بلاد جازس برضو ممكن تشوفها كده براحتك وتكتب تعليقك. When you finish, just tell me. By the way, usually nowadays we use lactate. Lactate used as a marker for inflammatory marker is the new inflammatory marker. It's called serum lactate and can determine the severity of sepsis. Chest X-ray second day post-operative, and this is chest X-ray. هحاول اكبرها لك شوية. اوكي، لو انت لاحظت في الشيست اكس راي the patient left breast is absent, right breast is present, but chest اعتقد was normal. بس ده كل اللي هشوفه. في اي حاجه is anything you need to review again in the sheet?
ABG, I think I need to show the ABG.
ABG, okay.
Each normal. CO2, oxygen, normal bicarb 22. Sodium.
You can write in exam. You can write any details. You can write in paper, and after that you go to the next paper, the next room. So you stay in this sheet. This sheet is bigger than this one. You will stay for 9 minutes. Okay. After that, you meet me in the main station. So we go to the main station. When you went to the main station, you can find the same data. Now we are back to the same station. In the same station, you can find the same file. So you can use the file again. Okay? And you can find the summary of the case, and you can find all the file of the case. This is the same data repeated. This is the bungalow, which is countryside, small house, if you don't use for that. And you can start now to speak to me. In this room, you can find a telephone, and in the telephone, they say dial 1138. So it is my number in the other room. So first thing you need to tell me, I am Dr. Osama. I am candidate number 20 something something. So it is important, don't miss to mention me your candidate number, not your telephone number. Candidate number. Of course, you don't mention your name, just your candidate number. And after that, you need to start. Okay? So when you are ready, you can start.
Okay.
Okay, so you can start. Okay. Start.
Yes. Hello.
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 Good morning.
Good morning. My candidate number is 1969.
Okay.
My name is Dr. Osama.
Okay. Usually in exam, we don't ask you about your name. Okay. What else? But you can type, I am Dr. Osama. Yes. Okay. All right. Okay.
Yes, I'm Dr. Osama. I'm SHO doctor. I'm working with Mr. Alexander.
Wilverson. Alexander. Okay. Right. Okay.
Alexander.
Okay.
Please, I need to speak to the on-call doctor today about we have a patient is done mastectomy.
Okay, no. This is my patient.
Oh.
It is my patient or not? انت دلوقتي بتكلم whatever the name. انت أسامة.
Yeah.
You call me. I am Mr. I think I am Wilverson. I am Mr. Wilverson. So this is case. Is my case?
Okay. Hello, I'm Dr. Osama. I'm working.
Okay, go on. All right. It is my case or not my case? You don't answer me.
Yes, it's not 65 years old background.
No.
Yes,
it is not my case. It is my case or not my case?
It's not my. No, it's not your case.
Oh, so why you call me?
Because you are you.
Okay, so it is not my case.
I'm calling
but because I am in call. So I am Dr. Osama. I speak to you about a case. This case is done by Dr. Browis or Alexander, whatever. So it is not my case. Okay, tell me about the case. Okay, you can tell me about the case.
Yes, I have a okay. I have a patient 75 years old. The
Okay.
patient is done operation, mastectomy, and lymph node
How
clearance.
how many days ago?
2 days.
2 days ago. Okay.
2 days ago for the breast cancer, and now she has axillary. And she has now axillary swelling, and his drain suction about 500 cc of the blood.
So,
And the
doctor,
patient,
what's this swelling called? What is the name of this swelling?
it is swelling in the axilla. I think it's the seroma.
Seroma or hematoma? Can be seroma, can be hematoma. Okay.
Yes.
So what happened to this patient? What this blood come from?
I think blood is coming from the reactionary bleeding from the site of the operation.
Okay. All right. So what you do for this?
For this, the patient, I will start to take some investigation to the patient.
Like what?
Like do a complete blood count to show to the CBC.
What is the value? Doctor, relax. So what is the value to know the full blood count and the hemoglobin level?
Yes, to show if you have any bleeding.
No, you already have a bleeding. So why you take a blood sample for hemoglobin?
If maybe patient need to blood transfusion.
What is the indication of blood transfusion in your country?
If the patient blood below the 9.
Make it 8. Okay, no problem. So, Dr. Osama, so now...
Below 8.
Okay, below 8. So now I ask you 2 questions. And you can save a time if just to say, I will do full blood count, looking for hemoglobin. If hemoglobin less than 8, I give the patient blood. Okay? So this is the easy way and the easy way to pass. You know the knowledge, but you are prompted to have a knowledge. Okay? So I will do full blood count. If the hemoglobin less than 8, so I give her blood. But this patient hemoglobin, I think, is 9 or something, so I don't give her blood. What else you did?
And another thing, I need to check to the patient maybe that need to do evacuation of the blood.
They have about 500. She may need or she need.
Yes, she need.
She need. برضو must be accurate. She need evacuation of the blood done under anesthesia and followed by compression. Okay?
Yeah.
All right. So احنا كده خلصنا الجانب الايه الطبي. So we speak about from medical point of view, this patient today have seroma or hematoma and hemoglobin is more than 8 or 8. So I don't give her blood or just prepare the blood for saving. And I need to evacuate this hematoma or seroma and make a compression before the patient discharged. Okay. So كده we finished the medical point of view. After that, so you mentioned that this patient have shortening of breath. Okay? In the notes, they mentioned that this patient, what else in the patient? What other comorbidity in this patient?
Yes, comorbidity. If the patient has a history of the chronic obstructive pulmonary disease, COPD.
Yeah, it is a past history. What about now? What about his lung condition now?
Now patient has shortness of the breath.
Okay, so what you will do for this shortening of breath?
What you will do?
What you did عملت ايه يعني?
I need to check to the patient. I will do chest X-ray to the patient. And
you already done, doctor. He's already done in the data. You did chest X-ray, okay? And what else?
And arterial blood gases to show to the ABG to the patient.
Okay, so what is your comment in chest X-ray? What is your comment in the arterial blood gases?
Chest X-ray is the normal chest X-ray.
What is the arterial blood gases comment?
I think in arterial blood gas is the normal ABG.
Normal ABG, arterial blood gases. Okay. So this patient, so what you think this patient have?
Patient is
No, no, as a chest condition.
yes, could be the patient have maybe due to hematoma in the chest, and the patient maybe have patient have the due to chest infection,
Chest
or maybe
infection can
patient
be
due to
chest
any
infection. Okay, so who will treat her? You will treat her, or you ask help of anyone?
yes, I asked to the help to the another one, another
Which
doctor,
one? Which doctor?
medical doctor to
Chest
treat to
physician.
the
Okay. Okay. So
yeah.
we summarize what you mentioned, Dr. Osama. So you tell me this patient have shortening of breath, for which I make chest X-ray. I did or ask for arterial blood gases and already have the result. And I think the result is okay. Maybe have mild chest infection. So I will consult a chest physician or a medicine doctor to look for her. Okay. So the
Yeah.
next question: can this patient be pulmonary embolism?
Maybe it could be you pulmonary embolism, but the pulmonary embolism it's okay during to the 10
Usually,
days
pulmonary
until
embolism
post-operative,
occur
or
after
due
how
to the
many?
patient
10 days. Okay, so
10
this
day.
pulmonary embolism can be done by 10 days, but sometimes can pulmonary
Can be occur.
embolism presented early, in which case?
Maybe patient have DVT.
No, no, I mean that some patients can have pulmonary embolism after 2 days, not in this patient, in other patients. So which
Yeah,
patient
another
can
patient.
have, yeah, which patient can have pulmonary embolism after 2 days?
Patient bedridden, or patient have orthopedic operation, or
Okay, that's good. Okay,
mhm.
so how to diagnose pulmonary embolism?
Yes, you can diagnose pulmonary embolism. First, it can be diagnosis patient dyspnea, confusion, low oxygen saturation, and the post diagnosis and the gold diagnosis do CT pulmonary angiogram.
Okay, done. All right. Okay, so now we finish the clinical knowledge. So I ask you, present the case in brief. I ask you, what is this hematoma or seroma? What you will do? I will do full blood count, looking for hemoglobin, prepare blood, and I prepare myself for evacuation and surgery, and after that compression. And this patient also have chest problem. I will ask for blood gases and chest X-ray, and it is within normal, but I will ask the chest physician or medical doctor to look for her to exclude any chest infection and give her proper antibiotic. Can be pulmonary embolism? No, because it is the second day. But sometimes, if they ask you, the examiner, can pulmonary embolism occur early? Yes, if the patient already bedridden, if the patient have surgery in long bone, and they can have pulmonary fat embolism. How to diagnose it? Clinically, pulmonary embolism clinically, by dyspnea, by arterial blood gases, and the confirmed diagnosis by CT angio for pulmonary artery. Okay? So now we finish our clinical part. So we go to the communication skill part. So why you call me? You did everything.
I
So why you call me?
Yes, I will call you because to inform you about the patient. Is the patient is need go to the home against to the medical advice.
Is the patient need to go to the home or her daughter?
Yes, it's the her daughter is the need to take
Okay.
her mother.
So if this patient is oriented and have capacity to sign the consent or to consent to her, or she is drowsy,
No, she is oriented
oriented.
to that.
So if the patient is oriented, we discuss with the patient, not her daughter. Her daughter can be included, but she is not responsible. The main topics is how to deal with the patient. But suppose this patient, you tell me that you stay about 20 minutes to discuss with her daughter and the patient about that. So
Yes.
suppose they are insisted to go home. So what shall we do?
Mhm. I will, yes, I will contact with the patient and her daughter and spend about 20 minutes about to, but unsuccessfully, patient need to stay to the hospital because it's
Yes, I know
convinced
that.
from her
Don't
daughter.
repeat it. I know that. So what shall we do? What you will do?
Yes, I will inform to the patient about the complication and about what can be happening against the medical advice, and inform to the patient he has a sign about to the sign in the legal document
What you mean
about
by legal document?
yes, about the patient need to go to the home against medical advice.
So discharge
And
against medical advice. Who will sign it? The patient or her daughter?
no, this is the patient.
Okay, that's good. So the patient can be signed discharge against medical advice. So what is the favor you will do for the patient? What's the instruction you give to her?
Yes, I will inform to the patient about if have any alert sign like any dizziness or any sweaty or any pain or any loss of the consciousness or any bleeding, can contact it with the near hospital or call to the ambulance to come
So
back here to
how
the
the
hospital.
patient knows the near hospital? This is a countryside, like rural area. So how she can know the near hospital or near GP?
Yes, due to maybe due to visit of the GB
No, 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 no,
doctor
no.
to the
Just a
house.
question in Arabic. هي هتعرف منين النير جي بي؟ هي هتعرف منين النير medical advice؟
Mm-hmm.
How she can know the place?
I don't know.
Okay, so you need to give her the place. Okay, so you can. So what is the favor you make it? Of course, you will ask her to sign a consent against discharge against medical advice and ask to go to near by hospital or GP clinic. And I give her the address and telephone of the nearby medical center. So in any case, she can go to there. So why you do that? Because this patient is about 100 kilo away from our hospital. So if it is have any complication for this 100 kilo, she is possibly will die. Okay.
Yeah,
So why you are concerning about the charge? Because this patient is far away from
far
hospital
away from
and in
hospital.
the rural area. So after that, what you will do?
Mm-hmm.
What is the next step in
Yes,
the
after
exam? You finish. What is the next step? You are in exam now.
now I need to summarize.
Okay. So don't forget to summarize like the people for
Yeah.
delivery. Can you summarize?
Yes, I'm call you to inform you about the patient, 75 years old patient, 2 day back history of the operation, 2 day back operation of the mastectomy and lymph node clearance, and patient history of the chronic obstructive disease and liver and the left ventricular failure. A patient, he is convinced from her daughter to go to the home, and patient have risk from
يعني
some.
Dr. Osama, you can start from here. I just tell you, you need to tell you that we have 75 years old, did mastectomy and axillary clearance yesterday. She had hematoma and she need to be discharged against medical advice. Okay,
Yeah.
so no much details. Okay, all right. After that, what you need to do?
Yes, thank you.
Thank you. Okay.
Thank you to the doctor. Mhm.
So to summarize, he start by it is first to confirm that whom you are speaking. Second, if the patient in this case is not related to me, I speak to you because you are consultant in charge. And this is case done by another doctor and the name of the doctor. And summarize in brief. After that, he ask you some clinical question. After that, this patient have a capacity to sign the consent. So she will sign, the patient, not her daughter, the charge against medical advice. I afraid because she is away from the hospital. So I do a favor for her. So I will give her the address and telephone number of the nearby clinic. Okay.
Mhm.
Summarize. Thank you. Okay. Very common station. It is the charge against medical advice. Any
عفوا
comment? Anyone?
دكتور شيرين.
All.
دكتور شيرين, يعني تو في when you summarize the case, maybe the examiner stop me as don't give me the all the time to summarize the case in the first.
لا هو examiner is usually not to stop you at all. The examiner leave you to do anything because this is from your time. But of course, some detail is not necessary. Like for
Yeah.
example, in the history, I write this patient have mass in the upper part of her breast, and this fine needle aspirated cytology done, and it is a cancer, and the mammogram confirm it is a cancer. This is already no value because already we remove the breast. We speak about hematoma. We speak about discharge against medical advice. Usually, the examiner, we are in teaching session. The examiner is just listen to you till the bell 10. After that, he make no mark about Sankis or he not complete the summary. This is why the student fail, because the main cause of the failure of the student, apart from coming to see the cases before, the second is bad management of time.
Yes.
Okay. Of
You
course,
mean
in the exam,
very important.
we don't allow to have watch in your hand, because some students use it, especially smartwatch. You don't have a watch in your hand, so usually you have 3 minutes remaining and all this. So you need to have good management of time. So usually the examiner not interrupt you at all. Okay. All right. Any comment from others? This is a very common station. Discharge against medical advice. Any comment? Okay. Thank you, Dr. Osama. Okay. So the second scenario, yes, you can
دكتور لو
ask.
سمحت كنت عايز اسال بس على
يعني دكتور
اول صفحه
كلمة في الآخر لما بنقفل المكالمة كلمة ثانك يو يعني لا درجة يعني.
قول تاني. هتقول له ثانك يو. ايه المشكلة؟ ايه المشكلة يا دكتور؟ انت بتقول ثانك يو to confirm that you finish. You hear me or
Yes.
انت عايز تقول ايه؟ طيب انا ما فهمتش.
لا أنا قلت لك يا دكتور يعني كلمة ثانك يو يعني قبل ما نقفل المكالمة مع الكونسلتنت، يعني كلمة ثانك يو يعني بيكون عليها درجات، يعني زي ما قلت لحضرتك للتأكيد.
لا هو بص، انا هعرف ازاي ان انت خلصت الاول. انا هعرف ازاي ان انت خلصت. انا how to know that you finish.
Yeah.
Even in clinical, it is the same in the clinical. How to know that you are finished? By thank you.
Yeah.
Or you can tell me finish. Already finished.
Yeah.
Okay? You know that it is like if you see any song, you can know that it is about to finish. I tell you at the end. Okay. So any comment? If no comment, so we have the second
انا
scenario.
دكتور كنت بسال على اول صفحه، ده السامري ده بيبقى موجود فعلا في الامتحان ولا دي حضرتك اللي عامل السامري كده؟
لا هو انا عمله، بس هو في الامتحان لو if this patient have discharged, we have discharge summary or letter from GP. Okay. But لكن مش not all station you have a summary. Sometimes you have referral from GP. Dr. Hussam Kandil, what you need?
دكتور واحنا نعمل سمرايزيشن في الاول خالص، سمرايز الكيس، بعد كده في الاخر خالص هنسمرايز، هنقول احنا المفروض هنعمل ايه.
Summary in the beginning it describes the case. A summary at the end about decision. So it is different.
الخطوات اللي احنا هنعملها يعني اخلي اعمل كونسنت للبيشنت ديسشارج اجينست ميديكال ادفايس، وبعد كده هكتب لها العنوان مثلا، او هقول لها الساينز والكلام ده كله.
تمام. انت جاست سمرايزد. في اي سؤال تاني دكتور فادي هتسال او حد هيسال؟ تمام. تاني حاجه بقى في the second in the phone call, it is important. Suppose Dr. Sameh, for example, Dr. Sameh, if you work in general surgery and you have a case of splenic trauma, for example, and you need to call your consultant, so you speak to him a lot, and after that you tell him we have rupture spleen, or you tell him at the beginning we have rupture spleen, we need you.
At the beginning you have rupture spleen and we need you.
المهم بقى, it is very important if the abdominal aortic aneurysm in serious patient, in complicated case, so it is better to describe I need you first before you take a time to summary. After that, he calm you and ask you in the normal way. Okay. Anyone need to share the second scenario? We can use Sameh. You can start. You can see برضو this is again, this is summary maybe not happened and you can find from here, but I just read it. You can see the summary, I think.
Yes.
So you can write a notes. You call cardio-thoracic consultant to refer polytrauma patient to his unit. 35 years old man with RTA, blood pressure 100/80 millimeter mercury, Glasgow scale 14 out of 15, left hemothorax, fracture left femur. You put a chest tube, she drained 200 fresh blood, time of insertion, followed by 200, second hour, followed by 200, third hour. You are Dr. Richard. يعني سامح اسمه now is Richard, but you can say Sameh, no problem. SHO, working in emergency department, you speak to Mr. Wolfson. Examiner is Mr. Wolfson. Cardio-thoracic consultant in charge today about polytraumatized patient to refer him to the unit. This is the history. Sometimes you can start from here. Mr.
It's my
Man.
case in my exam.
Okay. Who's that? Is Osama or who?
Yes.
We can see, and you can see what you did. Mr. Man. Worker. By the way, Mr. Man is not an English name, but it's common in exam. I don't know why. Mr. Man, worker, 35 years old, motorcycle, came to emergency department by ambulance after an accident 3 hours ago. On examination, glaucoma scale 14/15, swelling left side. Airway is patent. A is patent. Patient can speak with us. Breathing is normal. No tracheal deviation, normal in percussion and auscultation. Chest X-ray refer right-sided hemothorax. Insertion of cyst tube, which is drained 200 of fresh blood at the time of insertion, followed by 200, followed by 200. Vital sign, pulse 120 per minute, blood pressure 180 millimeter mercury. Send blood sample for group and safe. Send a sample for full blood count, blood, sugar, and arterial blood gases. The patient hemoglobin is 7 and 1 unit of blood given to the patient. X-ray shows that the left fracture shaft femur. I informed the orthopedic team and they put him in Thomas splint. The abdomen is normal, confirmed by FAST scan, FAST. I think that's it. So any point you need to back?
No, thank you.
Okay. All right. So now you will speak to the examiner. So when you're ready, you can start. First, you tell what's your number, candidate number.
Okay. My candidate number is 353.
Okay.
Good afternoon.
Good afternoon.
Can I speak to Dr. Wolferson, please?
Yes, I am Mr. Wolferson. I am cardio-thoracic in charge today.
Okay, my name is Sama. I'm an SHO in the emergency department, and I have a case that needs emergency and needs your help right away.
Okay, so can you tell me about this case?
The case is 35 years old male patient who has a left hemothorax, and we insert and the fractured femur as well, and we insert the chest tube which drains 600 cc, and the patient right now is tachycardia was 120 beats per minute, and his hemoglobin had been falling to 7.
Okay, so doctor, can we start one by one? So this patient you mentioned is drained 200 from the chest tube.
He drained 600 in total, 200, and then after that 200. And
so
then after that,
yes. So what is most probably, what is the cause of that?
The cause of that is that there is a hemothorax.
Yeah, what is the cause of this hemothorax with mild bleeding 200?
Probably a lung injury.
It can be ascending aortic injury, can be thoracic aortic injury.
Yes.
Can be thoracic aortic injury.
No, it can't. The patient blood pressure is 100 over.
All right, so it is not. So suppose it is ascending aortic injury. We have another scenario about that. So what you see in the chest X-ray?
The pericardium is enlarged. The ratio between the chest and the pericardium is enlarged.
The ratio between the chest and the pericardium is cardiomegaly. But if you have a thoracic aortic injury, you have widening mediastinum.
Yes, cardiac tamponade, yes.
No, not cardiac tamponade. Cardiac tamponade is another topic. Cardiac tamponade is congested neck vein and the low blood pressure and hypotension. But if the patient have injury of the thoracic aorta, they have widening of mediastinum, and this is not in this patient. So I think most probably this bleeding can be from the lung or can be from the intercostal vessels. All right. Yes. So what you did for this patient for this bleeding? What you did?
The patient, we inserted a chest tube and we gave him 1 unit of blood. His airway is patent and he's breathing normally and talking to us.
So airway is patent. How to know that?
The airway is patent. The patient was able to speak to us when we
All
were
right, so
talking.
airway is patent. What about breathing?
Breathing
Is normal.
is normal, yes. Okay.
Okay, so can be tension pneumothorax.
No, I don't think it's.
What is the presentation of tension pneumothorax?
Tension pneumothorax.
So tracheal deviation.
Tracheal deviation, yes.
Hyperresonant in percussion, but in this patient, no tracheal deviation, and the normal in percussion and the normal in auscultation. Of course, doctor, all this data in the file, by the way. If you go to the file, you can find all this data. And the file usually in front of you if you don't summarize. So what else you mentioned? You make A, B. What is C?
Circulation.
Yeah, what you do for circulation?
Circulation, we gave him 1 unit of blood.
No, wait, just doctor, relax. How to give a blood? You put a cannula.
Yes.
Okay, so you put a cannula. Okay, you put 2 white port cannula. I give a patient fluid, and I measure the blood sugar, the blood hemoglobin. Okay, so why you give him blood? What is the indication to give him? What is hemoglobin, and why you give him blood?
Hemoglobin is 7, so I gave him 1 unit of blood.
Okay, so what is the indication of blood transfusion if the hemoglobin is less than 8? All right, and also you ask for blood and safe and all this. What else you did for this patient? What about the raw limb?
The patient has a fractured femur, left fractured femur, and I called the orthopedic department, and they put him on a Thomas splint.
Okay, what is the important structure you need to palpate with or after to insert Thomas splint?
The dorsalis pedis pulsation.
So distal pulsation. Okay, so the vascular is okay.
Yes.
What about his abdomen?
His abdomen is lax, and we did an ultrasound fast technique. And
what is fast? Fast mean? Focal assessment sonography for trauma. Focal assessment sonography for trauma. Focal assisted sonography for trauma. Fast scan. Fast is abbreviation. Is not fast mean quick, or not fast like in Ramadan months. Okay. All right. So you did a great job, Dr. Sameh. So why you call me? Why you call me?
I'm calling you because the patient is still bleeding from his chest tube.
Okay, so back again from start, Dr. Sameh. So you did everything. So why you call me?
Because the chest because I wanted to admit the patient to be admitted in your department.
But you did everything. You did a great job. You have ABCD. You fixed the femur. You give him blood. The patient is not so bad, and the glaucoma scale is 14/15. Is good.
Yes, but his hemoglobin is 7, and he had drained the chest tube drained about 600 cc of blood.
Yeah. So is my team or me? What she do different than you? In my team and me, as a Mr. Wilson, what shall I do? You don't did it.
There might be a lung injury or a bleeding vessels inside the lung, inside the chest that caused the bleeding, and the bleeding is persistent.
So what shall I do?
You take him to the OR.
OR. What is OR?
To the operating theater.
Okay. So we back again to the beginning, doctor. So shall I go now to the hospital, or can wait till tomorrow?
No, you shall come to the hospital right away.
Okay. So if the hospital is ready, you call the nurses and call the anesthesia in my hospital and my SHO to be ready to wait the patient or not?
No, I did not do this.
Okay.
I will do this.
All right. Okay. And stop. I will back to you. Dr. Osama, you have the same way of speaking like Dr. Sameh in your exam?
In the exam, call the doctor. First of all, I would let me to summarize the case.
Okay.
Inform you I have the patient polytraumatized patient patient glaucoma.
Okay, so you started the same way.
Or glaucoma 15.
So you started the same way.
And inform you. Yes.
Okay.
And inform you I have wide medistinum of the chest X-ray,
No, this is what mediastinum is another scenario, by the way. But it is the same. Also, we have the same scenario by widening mediastinum. Okay, we're back to you, Dr. Osama. So, anyone have a comment on this and Dr. Sameh talking? What is the best way to do this station? Okay, thank you, Dr. Osama. You can close your mic. So, anyone have an idea?
I didn't get why he is calling you this.
All right, I will tell you now. Okay. So, what shall anyone know? What is the best way? دكتور توفيق.
ممكن اقول يا دكتور؟
كان.
واحنا المفروض الستارت ان introduce yourself وتكلم الكونسلتنت وتوضح له البروبلم اللي عندك واحكي له سيناريو البيشنت جاي لي ازاي. يعني انا بس البيشنت ده تروماتايز RTA came with مثلا الساينز اللي عند العيان واقول له كل الديسكريبشنز اللي موجوده في الاكس رايز اللي معايا. وفي الاخر هو هيقول لي مثلا سؤال زي حضرتك سالته اللي هو طب انت بتكلمني ليه؟ اقول له البوزيتيف فايندنج او البوزيتيف حاجه الوحيده اللي هو عايزها وبعد كده اشوف لو في اسئله ثانيه هو عايز يسالها لي.
هو
بس
انا دكتور توفيق
يعني.
when I start Dr. Sameh first question I tell him if we have rupture spleen what you tell first the surgeon you need to come for surgery. So this is way of presentation is wrong, Dr. Sameh. So what you need to tell the doctor after you introduce yourself, you confirm is vascular. I have a case and this patient just 35 years old, RTA, all this, and I need you urgently. I will send you to the hospital because this patient needs thoracotomy because they have 200. It is one of indication of thoracotomy. I will call the operative theater. I call the anesthesia. I call your SHO. After that, the examiner tell you, calm, doctor, can tell me you can start from ABC. So the beginning in the widening mediastinum, thoracotomy for bleeding because we have the two station or rupture spleen. So I need your help urgently. I need you in the hospital because this patient have indication of thoracotomy because if the left is this patient more, they have more bleeding. After that, we start by what we mentioned. Yes. So this is why I ask you why you call me. Why you call me, you need to start it from the beginning. You can understand.
Yes.
It is clear if you have dangerous situation like rupture aortic aneurysm, widening of mediastinum, chest tube have 200 or 150. Because the next question, what is the indication of thoracotomy? Dr. Sameh, what is the indication of thoracotomy in chest trauma?
Persistent bleeding for 200, then 200, then 200.
What else if insert the chest tube and how much coming? 100, 1.5 liter.
1,000.
Okay. All right. So the scenario will be reverse. So what happened? You insert. You tell him I have. You can tell him all this. I have 35 years old after RTA and after stabilized after resuscitation according to ATLS or ABCD. So we found that the patient after insertion of chest tube they have 200. So it is indication for thoracotomy. So I need you. I call the hospital. The theater is ready. I call the anesthesia in your site. I call your houseman, whatever, if it is in the same hospital or other hospital. After that, the examiner asks you, okay, can you tell me what happened? So we start by air, breathing, circulation, how to prepare blood, what happened to the femur, what is the abdomen, what is the first scan, and of course you have all this data. And after that summarize. So if the doctor in the same hospital, so I will be ready in the theater waiting you. If in other hospital, I will send the ambulance and with the doctor of our team. And I think the theater is ready in your hospital. And thank you, Mr. Wilson. Okay? Okay. So it is clear. So it is easy. Doctor, Osama, you have this station.
Doctor.
Okay. I think you have the same mistake.
This is station. It's not a station. It's not my station. It's my station.
Yeah. I think your station is widening mediastinum. It is the same principle. But the same principle, widening mediastinum is the same principle. You tell him we have widening mediastinum, it is urgent, I send you to the patient. After that, because
Yeah.
this is exam, he asks you about A, B, C, D, ask about fracture femur, ask about vascularity, ask about indication of blood transfusion, ask about fast scan and what it means. So it is the same,
Yeah.
like just a little change.
Yeah.
Okay.
دكتور هو احنا مش في الاول
Okay.
مش احنا في الاول بنقول الايم اساسا بتاع ان احنا نتكلم الكونسلتنت ليه؟
Say again, what is the aim?
في الاول خالص بنتكلم الايم سواء ريفير مثلا او سواء فور ادفايس او تو ابديت
ايوه انت هنا عايزه عشان to do an operation or just to refer the patient.
لا علشان الاثنين يعني
Thoracotomy.
بوث ادفايس
For thoracotomy.
ادفايس طبعا اور
لا
ثوراكوتومي
مش
يعني
ادفايز دكتور بص
مم.
هو مش ادفايز دي
يعني هندل
if you
البيشنت ازاي على
need to
ما هو
ask
يجي.
him this is patient have acute appendicitis or renal colic so I don't confirm it so okay we can see him, this patient tomorrow.
مم.
But this patient I need the surgeon to come now.
اوكي
يعني just simple. Suppose this patient impending rupture aorta, which is common in UK. So if you start to speak about the patient detail, maybe take long time, so the patient will die. So you just tell him in the beginning, I need you to come because this patient is urgent, he need an operation.
اوكي
واضح يا
ماشي.
دكتور حسام ولا I don't understand you؟
لا تمام واضح.
يعني هو الريفيرر انت يعني when you call a consultant sometimes you need to ask the consultant okay you need to come so it is very important. Okay, I think is one of the doctor, his name is Abdurrahman. Okay, I just ask him to come. So it is important to know how to manage. Okay, so it is urgent situation.
اوكي
Okay. Dr. Abdurrahman, you enter or, no, or still not? Okay, I just a minute. I just try to have him. Just 1 minute. Okay, I still just 1 minute. I try to invite one of the candidate. I don't found him. I send him email, so it's okay. Okay, so Dr. Abdurrahman, you enter or still not? Okay, so the third scenario we have.
لو سمحت يا دكتور ممكن اسال حاجه في نفس السيشن دي؟
اسأل.
هو في الفايل اللي هيجي لي هل هيقول لي انت المطلوب منك تعمل ريفير للبيشنت دوت للكونسلتنت في الهيز يونت او في الهوسبيتال، او هيقول لي ابعت هذا الكونسلتنت؟ هيبقى واضح، هتبقى كلمه
لا
واضحه.
هو ما فيش ابعت هات
أو كلمه.
الكونسلتنت، ما فيش بتبعت تجيب حد. انت either refer in the same hospital if it is a big hospital or to other hospital if you are in a small hospital.
يعني في كده الوضع هيبقى refer to your unit.
The aim of this station is to know what is the type of urgency, like this is urgent operation or not urgent operation. What you think is urgent or not urgent?
اوكي السؤال الثاني استاذنك حضرتك كنت قلت ان انا I've informed the anesthesia team والثياتر واليو اس اتش او
هو دكتور you are working surgery or not, by the way, Dr. Omar,
Yes,
you are working
vascular.
hospital. Vascular, in which hospital?
vascular surgery.
Which hospital you are?
في كبر الجامعي.
Okay, so suppose you are you have a case of rupture aorta and you need to call your consultant which is in the same hospital. So before you confirm to speak to him, you tell the anesthesia and call and theater nurse or not?
Yes, محضر كل حاجة الأول.
طيب انت why you don't need to do that in exam?
تمام.
يعني ايه الفرق بين حياتك وبين الامتحان؟ انا مش فاهم.
لا انا بشوف الطريقه اللي بعرض بيها
هو انت بص يا دكتور عمر، هو if you work in normal way like you do it in hospital it is easy to pass. If you work like you are thinking we need, it is the cause of failure. انت في المستشفى بتاعتك بتكلم التمريض الحقي دكتور فلان جاي، بتكلم الاسيستنز، بتكلم التخدير، ما ده اللي بيحصل ولا انت مش عايز تكلمهم؟
لا بنقلب الدنيا الاول وبعد كده الكونسلتنت بيجي.
طيب ما مش عايز تعمل كده في انجلترا ليه؟ يعني الراجل يجي في 5 دقائق. You know that in England it is to work in hospital you must live within 5 miles around the hospital, not far away. So he will come to you in 5 minutes. So must be everything ready. In the cardiac injury or stab in the cardio-thoracic or the impending rupture of aorta, usually the theater team, the nurse is scrub up and prepare everything even before the patient come. So when the ambulance man say, I have a case of the knife in the heart, or I have a case of the knife in the abdomen, or I have a case of the impending rupture of aorta, although it is ambulance crew, but have some medical, and usually the theater is prepared even before we see the patient. Because the nurse take a time to prepare the instrument, especially in vascular and cardiosurgery, they take a time because they have a lot of instrument, not like in appendix or minor surgery. So do as you did in your hospital. It is easy way to pass. Don't be so clever. Okay. I just need to ask again, is Dr. Abdurrahman is managed to enter or still have a problem? Okay. Abdurrahman Sobhi. Okay, I think I send him a link again, maybe. Okay. So any more question? I just manage this student. Okay, so the third scenario, just okay. You can ask.
دكتور
Yes.
معلش بالنسبه لي في الكيس بتاع هي asked me to think what you think about happened to the patient. يعني
what
يعني من ناحيه ان البيشنت have the feeling to be bleeding or seroma the site of the operation.
Seroma and hematoma is the same treatment, but hematoma is a blood, seroma is a serum. Serum is a blood minus fibrin.
Yes.
So both can the same treatment, whatever it is, seroma or hematoma. Usually the common is seroma, especially in fatty ladies.
Yes. When he asked me about what do you think happened to the patient about the shortness of the breath.
Yes, it is chest infection.
مش ممكن اقول maybe due to exacerbation of the COPD or
Is the exacerbation of what?
of the COPD. A patient is the COPD patient.
Whatever you mentioned, but it is not your job. You will ask for chest physician to come. But you did what you can do, just chest X-ray, arterial blood gases, and support the patient till the medicine come. Can be whatever.
Yes, okay.
Okay. All right.
Thank you.
All right. So who's next? I think this will be last one. So who's the next? Anyone? Just is the last one we're about to finish. Is the last scenario and this common scenario also. Dr. Hussam, I think you need. Okay, you can try. So Dr. Hussam, you see the screen now or not? I share it.
Oh, yes, I can see it.
So refer again to vascular department. You are Dr. Richard, or you can be the same, whatever your name. And for you are SHO for Mr. Wolfson, and you will be called Mr. Arthur is a vascular consultant in charge today to tell him about the case of lower limb ischemia. This is a summary, again, maybe not present in the case. Okay. So, okay, Dr. Abdurrahman, we start. This is the third scenario. So you are with us. So this is a 75 years old chronic smoker admitted abdominal pain, diagnosed as diverticulitis, relieved by medical treatment, and now he has complained of sudden acute left lower limb pain with a history of pain when he is walking, improved when he stopped 5 minutes, is hypertensive on brandodorpil is a coversil and has a history of AF, but is not in any treatment now. Vital sign is normal, except pulse is 100 and irregular. Chest and heart are normal. Abdomen is lax. On examination of the left leg, cold, loss of hair, decreased sensation, reduced motor power, and peripheral pulsation are weak. Arterial blood gases, ECG is attached. Of course, not all the cases have a summary, but you can have this summary is a referral from the GP. But what you have like this. The same also 75 years old, chronic smoker, admitted with abdominal pain, diagnosed as colon diverticulitis, relieved by medical treatment, and now is complained of sudden acute left lower limb. The pain is increased by walking, improve when he stopped for 5 minutes, cramping in nature, not radiated. Past medical history, he is hypertensive on the coversil and also have history of AF, but is not any medical treatment. On examination, vital pulse is 100, regular blood pressure 140/80, chest is normal. Heart examination is normal, but irregular heartbeat. Abdominal normal lax. In the vascular examination of the lower limb, right lower limb is normal, left leg is cold, loss of hair, decreased sensation, decreased motor power, weak dorsalis pedis, posterior tibial is weak. Investigation, this is a blood investigation. You can look to it and write your notes. After you finish, just tell me to go to the next page.
Wait a second.
Okay, shall I go to down?
Okay.
This is renal function test.
Just a second. Uriah. Sodium. Tassimoti. كريات عالية. تمام.
liver profile.
فيشر. ايه just a second. normal, consider normal.
Okay. So total cholesterol is 340 and serum lactate is 2. Again, serum lactate is important. It's a parameter for infection.
هنا normal value يا دكتور.
Of
عشان أنا بس
normal
مش شايف.
value from 0 to 2. It is high normal.
اوكي يعني normal.
Within normal.
اوكي.
And this is arterial blood gases.
pH low. هو في متعاد 2 CO2 ولا هنا كان ولا دي غلطة ولا ايه؟
ده يبقى هي الأول دي 12 دي دول أكسجين. أوكي. أصل الكتابة بالطريقة دي أصلها بتتعب يعني. أوكي.
ماشي اوكي هنا 4 هي بتتعب العين كمان.
بس هو ده what you see in exam. It is like what is called script brush or brush script. It is a way of writing. brush script. MT.
اوكي دكتور.
ECG.
atrial fibrillation. اوكي ماشي. اوكي.
And you.
ECG. ماشي.
Okay, so now you prepare your paper. You stay about 9 minutes in this room. After that
دكتور في الانجيو ده كان occlusion صح؟ عشان بس
هتشوفه هتوريه لك تاني ما تقلقش.
اوكي.
Okay, so if you go to the second room, you can find the same data. So if you have any query, you can look to the file again. So you can find the file again. The file is big more than this, about 15 paper or something like that. Okay, so when you're ready, we can start.
Just a second. هو بس الكونسلتنت مين؟
Okay, so Mr. Wolfson.
Mr. Arthur?
No, and Arthur. I am Arthur. Okay.
Good morning.
Good morning.
I'm candidate number 20008.
Okay.
Okay. Morning. So I'm Dr. Hussein Marzou, the SHO working for Wolfson, and also I'm speaking to talk to Mr. Arthur regarding.
Yes, I am Mr. Arthur. Just to confirm him, it is first. Yes, I am Mr. Arthur, the vascular consultant in charge today. Okay, what you have? Tell me.
So I'm speaking regarding a patient whose name is I am كتبتش اسم البيشنت. Okay.
Okay.
That's anything, and the age is 75, and his main problem he underwent a colon diverticulitis, and his problem that
okay, okay, go on, okay.
Okay, diagnosed by diverticulitis. Okay. He didn't want under any operation. Sorry. He had a sudden acute left limb ischemia, and he's complaining of weak pulsations. دكتور انا ما قريتش طبعا البتاع كلها وما لحقتش الخصها، فهو مش عارف كان عنده RTA تقريبا صح؟ ولا
لا ده مش RTA ده. لو لمب اسكيميا. انا مسحتها كده. لو لمب اسكيميا.
طيب.
اوكي. بعدين.
يعني he's admitted for diverticulitis and he's having a
so you summarized. After you summarize, what's your diagnosis, doctor? What is your diagnosis?
Diagnosis lower limb ischemia. He have a weak pulsation.
Doctor, can be more accurate. It is right side, left side.
Left.
You see the screen. So left lower limb ischemia. Are you sure?
Left lower limb ischemia.
Are you sure?
I'm sure.
Why you are sure? Why it is ischemia?
Because there is a weak. He has a weak in the motor and weak sensation and low, weak pulse also, and pale.
Okay, so Dr. Hussam, just relax. This is ischemia because from the history, the patient have pain, the patient have claudication pain or intermittent claudication pain, and from examination, because the patient have loss of hair, the patient have weak pulsation, the patient have decreased sensation, the patient have cold limb, the patient have decreased motor power, all these. Okay, so what is the cause of that in this patient?
In this patient, the atrial fibrillation caused a thrombus, causing
no,
occlusion.
just a minute. Atrial fibrillation cause embolus, so can be embolus due to atrial fibrillation.
Yes.
Can be thrombus. How old is the patient? How old is the patient?
The patient is 75.
75. So can be thrombus. What else?
Can be thrombus, yes.
So can be embolus, can be thrombus, can be dehydration.
Dehydration can be from
Due to
drugs
why?
if he's taking.
Okay, so this patient can be the three. Can be embolus because have AF. Can be thrombus because old age and atherosclerosis. Can be dehydration because the patient have diarrhea due to diverticulitis. Okay? So can be embolus, can be thrombus, can be dehydration or hypercoagulability state. Okay, that's good. Is this leg is still viable?
Yes, because
of what?
there is still sensation.
So because they still have some movement and some sensation. So is this patient you need to transfer to my unit? Is fit to transfer because I am in other hospital? Is fit to transfer?
Yes.
So how to transfer him? What you give him in the ambulance?
I'll give him high fluid, high oxygen and IV fluid, and I'll give him maybe low molecular weight heparin.
No, just a minute. What you give in
motorist.
transfer is not what you're giving in the hospital. So I don't understand why you may you say
oxygen and IV.
Intravenous fluid. This patient in pain also, so you need to give him analgesic. What you mean by high flow? You mentioned what is oxygen?
Yes, oxygen mask.
No, you mentioned something strange like high something. Or what you mentioned?
High flow oxygen.
What you mean by high flow?
High flow, it's the rate.
What is the normal rate of oxygen?
10 to 15.
10 to 15 per hour or per minute or per what?
Per minute.
Okay, so it is 10 to 15 liter, but it is okay. So don't dig in some details. It is not necessary. Of course, it's not in the just to give oxygen, intravenous fluid and analgesic. Of course, you prepare by give him oral anticoagulant. Is this patient have ischemic bowel?
No.
No. Okay. Is ultrasound help in diagnosis of mesenteric vascular occlusion or not?
No.
No. Okay. So is this okay? All right. So what is the type of pain? What we call this type of pain?
Claudication.
Claudication or intermittent claudication pain. Okay. If you see the arterial blood gases.
intermittent.
intermittent يعني كل شوية. ما هو الكلوديكيشن بين مين intermittent pain. Claudication mean intermittent claudications like he stop. Can you see it is claudication pain? No problem. Okay. What is your result of arterial blood gases?
Metabolic acidosis.
Metabolic acidosis. Are you sure?
Yes, I'm sure.
What is ECG result?
Atrial fibrillation.
Atrial fibrillation. Who I think I don't expert, but I have some ventricular ectopic. So how to treat this condition?
I would monitor his ECG and treat his electrolyte disturbance.
No, doctor, relax. I just ask you not to treat this condition. We speak about AF, how to treat AF.
Okay, I'll just call for the help of the consultant cardio-thoracic or the cardiologist.
You don't need the consultant. So usually the consultant, the cardio-thoracic or cardiologist مش لازم يبقى consultant, and usually give him beta blocker for the rate and anti-arrhythmic drug. So what is the effect of the GIT on the electrolyte?
The absorption of the calcium.
In this patient, what is the electrolyte disturbance occurred due to diverticulitis?
Diarrhea caused electrolyte disturbance.
Which electrolyte disturbed?
Low calcium.
No, مش calcium, ده potassium.
Low potassium, sorry.
Is this patient in sepsis or not?
If
you need to show the investigation, I show to you if this is in sepsis or not.
لا وانا ماسك بره النص انا كنت كاتبها لا اللاكتيت 2 the lactate is 2 so he's not in sepsis.
Not in sepsis, and the neutrophil also is not so high. Okay.
Yes.
All right. So we finish this. So how to treat in general? How to treat this condition?
Okay, I would just correct his hypokalemia. I would monitor his heart rate. I would start anticoagulants. I would correct
which anticoagulant you give and how to monitor it. If you start by oral, how to monitor it.
Okay, oral.
Yes, oral. Suppose you start by warfarin, how to monitor it.
INR.
What does INR mean?
The INR is the international normalized ratio.
It is ratio between what and what?
It's the patient PT time and the
what
normal
does PT mean?
Time. Prothrombin time.
What is normal prothrombin time?
Normal prothrombin time is from 60 to 80 seconds.
60 means 60? No, it is 15 seconds, 15.
15,
maximum 15.
Oh,
15.
sorry, the
15.
APTT. Yeah, sorry.
Okay, all right, okay.
So the normal is 15. 15,
all right.
صح?
Yes,
okay.
Second. So you give analgesic, you correct hypokalemia, you treat AF, you take oral anticoagulant and guided by INR, which is prothrombin time to the control. So what is the mechanism of action of oral anticoagulant? It's acting which pathway, intrinsic or extrinsic?
The warfarin?
Yes.
It's acting on the factor 2, 7, 9, and 10, which
make it easier, extrinsic or intrinsic? Extrinsic pathway, acting extrinsic pathway. Extrinsic, yes. EX. And of course, to correct metabolic acidosis. So why you transfer this patient to me?
So I transferred this patient because he need an intervention.
What is the intervention? What shall I do for him? You did everything. You give intravenous, you give anticoagulant, you give analgesic, you correct acidosis.
Maybe embolectomy, if he's...
Maybe, or doctor, maybe, or I will do. Shall I do embolectomy?
I think you should do embolectomy.
Okay, so shall I go to the hospital now? So do
yes.
embolectomy. After embolectomy, if it is still narrow, what shall I do?
Graft, maybe bypass graft.
Bypass graft is done in 10 years ago. I did it many times 10 years ago. Nowadays, I don't do it.
Oh, okay. So maybe
okay.
filter. Okay. So if
we still have constriction, so I do balloon dilatation. After that, I insert
a stent.
A stent. Okay. All right. Can you summarize?
Okay. So this patient. This patient will start. We'll just transfer him, and I will transfer him by the ambulance, and I will correct his electrolytes and start analgesics, IV fluids, and I'll correct his metabolic acidosis and start anticoagulant until we wait for your definitive treatment. Thank you.
Okay. You don't tell me, is this urgent? I need to go to hospital or can wait until tomorrow?
It's very urgent.
It's urgent. We called it urgent or level 1 transfer or blue code. So this is urgent. Okay. Actually, it is okay. Also, you prompted much, but it is okay. I have this station done many times, but in this station we have a strange problem because most of the candidates speak to me about mesenteric vascular occlusion, which is not correct. Simply because we mentioned many times this patient have no sepsis, the abdomen is lax, and the mesenteric vascular occlusion is dealt by general surgeon, not by vascular surgeon. I think it's Dr. Omar, if you work in vascular, you deal with mesenteric vascular occlusion or you left it to general surgeon?
لا, it's for the general surgery.
Okay, so but I don't know why in the many students in India, they speak about this patient most probably have mesenteric vascular occlusion because they have abdominal pain. Actually, he have diverticulitis, and this diverticulitis we mentioned because sometimes if patient have severe diarrhea, and this severe diarrhea can cause hypercoagulability state and can cause thrombus. So this patient has the 3 risk of embolus from atrial fibrillation not to be treated, risk of thrombus due to atherosclerosis and old age, risk of hypercoagulability state can cause thrombosis due to dehydration due to severe diarrhea. So it is clear.
دكتور شيرين معلش.
Yes.
هو بس انا يعني قنعت يعني موضوع الاسكيميك باول الام في او. هو البيشنت متشخص كلينيكالي ان هو عنده دايفرتيكولايتس.
Yes.
بس هو البيشنت ستيل لحد دلوقتي ما عملش سي تي، فهو
تمام.
فهو والبيشنت عنده ريسك فاكتور
انت عايز تحولها الى ان هو ميزنتريك فاسكولار اوكلوجن.
لا
تمام؟
مش عايز احول، انا قصدي يعني لو لو هو سالني does the patient have ischemic bowel، يعني لا مش هقدر اثبت له اقول له ولا هقول له لا، يعني هقول له probably او ممكن لسه ما نعرفش لما نعمل سي تي.
اصل هو انت لو هتقول له كده هيقول لك طب بقى اعمل سي تي وحوله لي.
ما انا هقول له انه مش ايرجنت بقى لان هو مش توكسيك ومفيش ساينز اوف بروتونايتس، فعندنا برايورتي بتاعت الاسكيميا اعتقد يعني.
هو this patient يعني don't be so clever. هو every why it is not stroke؟ يعني ليه هو مش ستروك مثلا؟ ليه هو مش ischemic heart؟ ما everything can be have a possibility. هو عنده abdominal pain due to diverticulitis. You expect this patient have mesenteric vascular occlusion and diverticulitis؟ يعني what is the relation؟
مش هيبقى عنده الاثنين، بس موضوع الدايفرتيكولايتس انا قصدي من الاستم اللي مكتوب ان مفيش حاجه بتكونفيرم ان هو دايفرتيكولايتس.
لا
يعني
هو treated as diverticulitis. اوكي لا هو ما فيش حاجه to confirm but he's in medical treatment and diagnosed as diverticulitis because if the patient diagnosed as diverticulitis by colonoscope we don't repeat the colonoscope because can cause perforation. يعني we don't have a tick or tracking exam so it is important to know that. اوكي alright.
دكتور شيرين كمان
اوكي تمام.
كمان فيما يخص كمان ان هو ان الحاله امبروفد على الفلويدز والانتيبيوتكس، ما هو ده بيرجح الكلام ان هي دايفرتيكولايتس، لانه لو هو اسكيميك مع الفتره دي كلها لا ده ممكن بقى بعد كده يحصل جانجرين.
انت بتكلم الفاسكولار سيرجن يبقى بتكلمه for his vascular top. We put this question just to ask about ask about that like not confirmed or not like this. I just added because I found many students speak about mesenteric vascular occlusion, which is not our issue. I think Dr. Sharif Gad, he need to ask something. What's your question?
Hi, Dr. Shreen, how are you doing? I was asking about if it is 15 pages in the preparation station, how can I just have a track to go through all of them in 9 minutes? How this can be possible?
No, انت دلوقتي you're looking for the case. So this is case if the diverticulitis and ischemia. So it's better first to go to see the investigation, leukocytosis, full blood count, hemoglobin level.
with يعني ابتدي الاول بالداتا عن البيشنت نفسه، بعدين اخش على طول على الانفستيجيشنز اقراها الاول.
من هو many file like operative notes is not important except if complication happened. Follow up chart like first day, second day, third day, just to see which day you are because it is important in pulmonary embolism. And you still don't. It is 9 minutes is a good time, by the way. But if it's still something missed, you can in the next room you have the same file, and no one see you. You have the same file in the next room.
9 minutes enough, but but I'm thinking about how to be fast enough, how to to focus on the important data. That's what I'm thinking about.
And it is important to write it in the paper. Okay, and you can find it in the second room also. Okay.
Thank you.
All right. This will be easy station. We don't have a lot of variety. I discuss with you 3. Next time we have 4. By the way, I think perforated viscous again is not in the phone call. It is in under physiology. Okay. So any question?
يا دكتور كنت عايز اسال بس.
اوكي
اتفضل.
Anyone. هو لو في انفستيجيشن هو سالني عليها وكانت اوريدي ما اتعملتش، مثلا سي تي اي سي جي، هقول له ان انا هعمله
لا you can ask in this patient if I ask you if CT is done it is urgent or important now or the safe the limb is important.
لا انا بتكلم جنرال. طبعا هنا كل اهتمامي على السيف ذا ليمب، انا بتكلم جنرال يعني على الاي سي جي مثلا بتاع اي حاله.
لا ECG all these are routine. Everything is done in the file if everything is done. Nothing. We don't have neglected case in the patient in the hospital at time of admission. All baseline investigation, ECG, chest X-ray must be done, except chest X-ray if the patient is young, less than 45. We don't do chest X-ray. So suppose
بالنسبة إن أنا ممكن ألاقي
suppose this patient, if you ask you, so you did abdominal ultrasound for gallbladder stone, I think is not important now, and it's not indicated. We're just looking for the important, which is this condition or this condition.
savings limb.
Okay.
Okay.
Dr.
Okay.
Sharif, you need to ask, or
شكرا.
Dr. Omar, anyone, you need to ask anything else?
No, thank you, doctor.
اوكي دكتور عمر عايز تسأل حاجة؟
دكتور
أنا
بعد
كنت
اذنك
بكلم حضرتك دلوقتي
بيجي
خلاص تمام.
اوكي حسام.
في سؤال بيجي بالنسبه للتايب اوف امبولانس. بيجي بيتسأل مثلا التايب اوف امبولانس نختار ايه بالظبط
انت شغال فين يا دكتور حسام؟ where you are working؟
اسكندريه.
اسكندرية. So what is the type of ambulance in Alexandria؟
blue light.
Blue light and red light, what is the difference? You don't ask yourself what's the difference.
يبقى فيها more equipments يعني.
Okay, so we have two type of ambulance. One is blue code and one is red code, or blue lamp or red lamp. So this one, I think, of the red is contain facility for both have facility of cardiac arrest, but one is have more facilities in the cardiac patients. So we are not interested in this, but just to tell him I send him urgently. Urgently mean we called it level one priority, like for example a priority like what is called in Arabic like something Qaswa, like first priorities. So it is first priority. We called it blue code. But it's not important to know that, it's urgent. Why urgent? Because suppose if they have a testicular torsion or have ischemic limb, so within 6 hours maybe we lost the testis or we can lose the limb. Okay? So just say urgent. Dr. Aya, what you need to ask?
بس كنت عايزة أعرف الديفينيشن بتاع ال INR.
International Normalizing Ratio. It's not a definition, it is abbreviation. It is International Normalizing Ratio. It is the ratio between prothrombin time, which is 15 seconds, over the control, which is supposed to be 15 seconds. So your INR is 15 over 15, so it is 1. If the patient take oral anticoagulant, we reach to 1.5 till 2 or more. If the patient prepared for surgery, we need to become less than 1.5. And to do that, either we give the patient fresh frozen plasma or something called the prothrombin concentrate. Or if it is not urgent, we can give him vitamin K. It is very common question in physiology, pathology, surgery, everything. I ask, usually it is a fixed question in exam, because in England, they have something called INR clinic. I think in some hospital in Egypt, they have that INR clinic. So this patient who take anticoagulant, they have a file or book and just follow up by what is the ratio of INR, especially if the patient have valve replacement, stent, and all this. Clear?
يعني لو عيان بياخد وارفرين وبعدين عملنا بريدجنج، المفروض أعمل عملية لو هو وصل 1.5.
If it is for urgent operation or elective operation.
لو elective.
For elective operation, you can give vitamin K till the INR reach 1.5 and below. If it is emergency, you give him prothrombin concentrate. And in some country, like in Egypt, they don't have prothrombin concentrates. They give fresh frozen plasma. The amount is till the INR become less than 1.5. So not fixed amount. It's different from patient to patient. Clear? Okay. Very common question, by the way. Usually you ask about INR, prothrombin time, in many stations in exam. It is very, very, very important topic in UK. Okay. Best wishes to all. Inshallah, next time we will discuss. I think Dr. Sharif also need to ask some question.
I'm sorry, Dr. Sharif, but I have some notes. Warfarin, I think it's working on both